we continue our special series on the homeless crisis in Spokane with the series In Their Shoes. We're focusing on two groups who try to heal those who don't have a place to go.
Not thinking about their health if they don't know where they're going to sleep that night or they don't know where they're going to get their meal. Once they have those covered, then they can start thinking about their chronic condition.
An in-depth look at a partnership between Sacred Heart and Catholic Charities that allows the homeless to heal after getting treatment instead of being turned out onto the streets once again. Homeless people often wind up in the emergency room for the health care they need. Sacred Heart says about 5% of all emergency room visits at their hospital are homeless people. And that's part of the picture, but the other part is what happens after that initial ER visit. How do they heal and recover when they don't have the money to stay at the hospital? Our Hawk Hammer takes a look at a partnership that helps fix that problem in tonight's special report.
Many of us, myself included, might have a bit of trepidation sparking up a conversation with someone who's homeless.
I slept underneath that bridge right there for a couple of days, you know, with one eye open.
But like all of us, they have their stories.
Where it ain't cold out there in the wintertime, it's pretty cold.
Sometimes you just have to ask.
Everybody's like kind of prejudiced against them, which makes it even harder, and they just keep going down farther and farther.
These two men, Randy Thomas and Bobby Flowers, are currently on an upward swing after a downward fall.
Well, I was in the hospital for like a week from congestive heart failure, and I lost my place. I couldn't pay the rent.
Bobby was already homeless and had to have surgery for glass in his foot. He also has diabetes, a hard thing to have when you don't know when or where your next meal might come from.
You know, I needed a place safe and a place to stay.
So now put yourself in their shoes. You're down on your luck. Your health is questionable. You've just had surgery. You need to recover. But you don't have a home, much less a bed. You don't have a shower, consistent meals. Your options, stay at the hospital as long as possible. That's the expensive option, and you probably don't have money. Or head back out on the streets.
Wound care, even if someone had an acute condition and they had a laceration and then they need to care for that wound, if you're on the streets and it's constantly dirty, there's a lot more chance for it to get infected. At least with this, you can heal, actually heal from something like that, and you don't come back to the hospital for something much worse.
This she's talking about, the Transitional Respite Program partnership with Catholic Charities and the hospital. Patients are taken here to the House of Charity and provided all their basic needs to heal. Without it,
Probably wouldn't have made my doctor's appointments and eventually been back in the hospital if not even died from it.
It's far from cushy, but it's something. The program is as much about healing as it is about getting lined up with resources.
It helped me out with, got my ID back, and housing.
But that's only part of it. The head of the House of Charity says there's something even more important, but it's subtle. They build a community.
Somebody to listen to, somebody to talk to, and that's where you can really get somebody engaged in case management that may never have before.
As Randy and Bobby wind down their days in the respite program, a month so far for Randy, more for Bobby.
You know, and then I just found out today that my Section 8 was approved, and it was like, that was a blessing.
They say they too see the homeless situation as a tough one to crack. But one thing they know, you can't approach it painting with a broad brush. You can't approach it without knowing their stories.
There are bad apples on both sides, homeless and not homeless, but for the most part, we're all the same. Mostly, we just need a chance.
I'm Hawk Hammer, KXLY 4 News.
According to the House of Charity, in 2018, they had 183 men and 58 women in the program. 29 of them were moved into permanent housing. The program has run for several years and is actually being used as a model for other cities like Olympia. Catholic Charities estimates they have saved the hospital millions through this program.